Welcome to the Millennium Mom Show, and it's me, your host today, Tolu, the Millennium Mom. Today we are actually discussing very serious issue. Yes, we are going to be discussing infertility on the show today, and this is not just for the moms. This is for my millennial women, my millennial moms, and millennial daddies, single ladies. Please sit back, relax. We have a doctor in the house that is going to be giving you all the information that you need. So we'll be right back after the break. Welcome back to the Millennium Mom Show, and it's still your host, Tolu, the Millennium Mom. As I said earlier, we're going to be discussing infertility. No, I am not discussing with you. I have a doctor in the house, and we have Miss how dare I say Dr. Ejiro. Hey, sis, how are you doing?
I'm very well, Tolu. Thank you for having me.
You are very welcome. It's like I love having doctors in the house. Like, do you know what I'm going to learn from you today? Not just me, everybody. So before we go into the chit chat, let my ladies, my mommies, my daddies meet you.
Okay, so I'm a medical doctor by profession.
Okay.
Specialized in radiology.
Okay.
Which is a specialty in medicine and surgery.
Okay.
Okay, so I'm a radiologist. I'm also married to an amazing human being.
Oh, great.
And I'm a mom of 2 boys.
Okay.
Yeah, so that's basically it for me.
Okay. I'm sure a lot of people are used to me having moms here, so we're not talking about, but something stands out about Dr. Ejiro for me, and it's the fact that she's a radiologist. Okay, I know a lot of you might have people that are in the medical field in your family. She's the first radiologist I am going to meet, and that was what I was saying to them, like, what do you do? So tell us, what do you do as a radiologist?
Okay, so radiologists basically deal with imaging.
Okay.
Okay, we're doctors that specialize in diagnostic imaging.
Okay.
Okay, so we do everything imaging to see your insides. I'm going to talk in as
very
layman terms as possible.
Okay,
yes.
Okay.
So I don't talk too much English.
Okay.
I'm going to break it down for you people.
It's okay, we love that too,
okay,
right?
So I'm a radiologist, and we basically deal with imaging.
Okay.
We use imaging modalities to look at the insides of your body from your head to your toe.
Okay.
Okay, so we deal with ultrasounds, X-rays, CT scans, MRIs, basically. Okay. And all these are imaging modalities that help us look at different parts of your body, from your brain, if you have a brain tumor, if you have cancer, if you have lung infections, if you're pregnant, okay, if you have gynecological issues, as a male, if you have liver issues, whatever, you know, okay. We just check your insides basically, and then we may help other doctors make a diagnosis. Okay. Okay, because usually when you go to the hospital, you see a normal doctor, like either a GP or even from any other specialty. Mm-hmm. If from surgery, ONG, pediatrics.
You name it.
Yes, whatever specialty you go and you see a specialist, they make a diagnosis. Okay. Okay, and they need us to help them confirm those diagnoses. Okay. So they now send you over to us. So we are like the doctors of all doctors, basically.
Pause on that. Have you heard? She's the doctors of all doctors. So when your daughter comes tomorrow and says, "Oh, Mom, I want to be a radiologist," I say, "Eh? What's that?" You can hear a radiologist is the doctor of all doctors. Because yes. To be honest, I also went into, they told me I'm a radiologist. I'm like, so what do you do? I know I can read about it. It's like, okay, yes, you can go to Google and go and find out. But it's nice to actually, hear from you. This is what we do. This is how, because I know how, I'll probably have to go and Google it if my child says, "Oh, Mom, I would like to be a radiologist." And we don't really hear about those kind of professions, because everybody's like, "I'm a doctor, and I'm like, okay, because now as a mom, I understand. Oh, I want to say, I want to say a pediatrician. Yes. I want to, see a gynae. Yes. As in, that side of it makes you more open to, but. This radiologist, until you have something that you actually then need to see a radiologist. And I remember when I wanted to talk to Dr. Ejiro, I had a particular thing in mind that I wanted to talk about. Until she then told me that, I'm a radiologist, broaden your thoughts. And that was how we came to this, infertility discussion. And it then takes me to ask you, what part do you play in finding out about infertility?
Okay, like we play a major role. Okay, infertility affects not just females, but also the males. So both husband and wife actually go through the whole process together. Okay, so radiology basically, depending on what you present with. When I say present, whatever your issue is. Yes, because there's so many causes of infertility. the ones that affect the females, the ones that affect the males. Okay, so when you come in, we help you check your reproductive system basically.
Okay.
So as a female, we use ultrasounds to look at your uterus, your ovaries, your fallopian tubes, your cervix, to find out what the problem is.
Okay.
And we have also what we call HSG, which most people that have gone through infertility process understand, and they're scared of, like, it's very painful. They say it's really painful. Okay, so we use that to also check their tubes, check the uterus for certain types of fibroids that can affect fertility, basically. Yes, and for the males too, we do ultrasound for them to check their scrotum, do scrotal ultrasounds, basically to check for varicocele, if they have any mass, for undescended testes, a whole lot that can contribute to infertility. So our department actually plays a very major role in,
well, for now, because this is, I know it's called the Millennial Mom Show, but I try to be very encompassing and make it like, okay, you can always watch regardless, even if you're a male or you're not a mom, you know, just a millennial woman can watch and learn. So what are the major causes? Because now we're very focused on both parties, which is male and female. What are the major causes of infertility? Okay, I would like to focus on our climb, not like generally, because I know there are certain things that happen here and people like, oh, you know, if you do this, I'm still going to go into the myth. Okay. It's like, don't do this if you do this. I'm like, so what are the major, medically, what are the major causes of infertility? Okay, the causes, I know there's a lot. There are a whole lot. I'm not going to go into everything. Okay, so I'm going to start with the females. The most common causes of infertility in our environment. Number one at the top of the list is non-patent fallopian tubes. Okay, in our environment, so many people, that's what they call blocked tubes. When you say your tubes are blocked, basically. So your tubes are not patent. Your tubes, the fallopian tubes are the tubes that actually help the eggs to travel into the uterus after implantation, after fertilization, basically. So if they are blocked, that affects the process of fertility. We also have certain types of fibroids, the ones that are inside the lining of your uterus. I'm breaking it down as best as possible. Yes, they call them submucous fibroids. They're the ones that occur or grow within the lining of the uterus. So those ones, depending on the size and all of that, can affect fertility. We also have hormonal issues. So many women are struggling with hormonal issues these days. Okay, once hormones basically are the we understand the hormones that help you help the reproductive system basically. So if there's some sort of imbalance, it can affect you getting pregnant. Polycystic ovaries too. Can I chip in on that before you go into the male one? What are the causes of hormonal imbalance? Because I know I talk about hormones loosely, and like, oh, it's my raging hormones. You know, we talk about hormones, but this is another level of hormones, which causes infertility, right? So, it's not like another level of hormones. Okay, now everybody, both male and female, we have hormones. Basically, the body produces certain hormones. Okay, both male and female, we have, even females have a level of, let me just break it down. We have the estrogen and you have testosterone. Now, both male and female have a certain level. Now, as a female, if the male hormones are more or higher in quantity than the female hormones, that's an imbalance. We expect a balance. Okay, so there's not like a known cause per se. We have advanced causes like when you have a pituitary tumor and all of that, you know, but it just happens for some people that they just have a hormonal imbalance, which can actually be treated. It's not like something so major. Yes, with drugs, you can balance it out hormones. And and you're good to go, basically. So that's also one of the causes in both males and females. They struggle with hormonal issues. Also, certain types of uterus, I don't want to go into that, it's not so common. I know. Okay, but these are like the major causes of infertility. Also, premature menopause. Some women just go into menopause before they're supposed to, like early menopause. Going into menopause at 35, 40. Yes, when you're supposed to be attaining menopause around 45, 50. If I'm not married at 35, because that's why I said I'm still going to go into the myth. The first myth I'm going to go into is the abortion myth. Oh, you've had so much abortion, you can't have a baby. I'm not saying that I am supporting abortion. I am asking the doctor a question. Is this true? Well, it's true, you know, it's true. I think the myth is when you have a lot of abortions, it means that the children that God has planned for you, you've killed half of them. It's not true. My sister is not true. That's not the reason. But abortions, frequent abortions affect conception, basically. Why? Because
depends on the kind of abortions you do. You know, there are two types. You have the medical, you have the surgical. The medical, you just take pills and then you push it out and you're good to go. The surgical, in some cases, women take pills. It doesn't come out completely. You still have to go back to the doctor to help you suction or evacuate, take it out, basically. Now, in the process of this evacuation, some sort of scarring occurs because there's a lining. Everybody's uterus has a lining. It's like you have a bruise on your skin. It heals to form a scar. The same thing occurs in the uterus. Yes. So it's the same process. Now imagine you're doing this suctioning like 10 times or 15 times. Let's even say as little as 5 times. You're scarring different parts of your uterus. And now when it comes to implantation, usually when the sperm meets the egg and they fertilize to become a zygote, which is a baby, an embryo. Now this zygote needs to implant in the wall of that uterus, that lining that has been scarred. Now if there are scars there, it would not implant. So that's the reason why it can actually cause infertility, not because you've killed all your children that God planned for you.
Sisters, it's not a myth. It's happening. It's real. Like I'm not like I have to touch on it because I know I hear it a lot. What if God gave you just one and you have taken it away? So it's actually medically it's not safe to do it, you know. And sometimes I'm sure it's also how it is done. Because sometimes not how much
well, not necessarily how it's done. Because even if you go to a professional, like a doctor actually helps you take it out. It's the process. It happens. Like too much suctioning sometimes, which you might have to do, which your gynae just might have to do because there's still something left in there. It just can cause the scarring. So
that kind of got me a bit, you know, scared. Me, I've finished my baby business, but it's just like I said earlier, single young women are going to be watching, and yes, don't listen to what mommy is saying about that's God children, but listen to what the doctor is telling you, that it is not actually safe to do multiple ones. So we're going to take a short break. I even think I need to take a breather from all this that I've heard, and we're going to be right back. So stay with us. Welcome back to the Millennium Mom Show, and we're still here discussing infertility with Dr. Ejiro, our radiologist. So, back to you, Dr. Ejiro. How long does a couple have to try before they start to think we need to see a doctor? Because I know women are paranoid. I have a friend that got married, and after 2 months she's like, baby, never happened, never show. You know? And I'm like, oh, calm down, but that's me. I'm sure in her house she's thinking, oh, you can say that, but you conceived on your wedding night. You're telling me what is not. So it's almost like I asked him that, how did you do it? Is there a specialty to doing this thing and getting pregnant at your wedding day? So how long does a couple have to try before they come and see you?
Okay, so usually we say a year. Okay, yes, you have to. Infertility is actually when you have frequent, unprotected sexual intercourse for at least a year without conceiving, without attaining conception for at least a year. Now we bring the age down to about we bring the duration down to about 6 months if you're above 35 as a female, and if you're above 40 as a male, for the following reasons. Usually, we women, we attain all our eggs, or all our eggs are already formed, at a certain time in our life. So we have a certain number of eggs. Now, as you're menstruating, with each cycle, you're losing eggs, you're losing eggs, you're losing eggs. Those eggs are not coming back. You're not bringing back more eggs. You're not producing more eggs.
You're losing eggs, you're losing eggs.
So your eggs are going, you know, and so by the time you get into 35, you have a certain number left. So you don't have as many eggs, as someone who's 18, and you don't have very healthy eggs compared to someone who's 18, because as you're getting older, your hormones, all of that affects the kind of eggs you produce. Yes, the same thing too applies to the males. Males, theirs is a little bit more gradual than ours. Yes, but it happens eventually over time. So that's why we give them 40 years. So now if you're married, for instance, your husband is 40, you're 35, you've had unprotected sex. Yes. 6 months. When I say frequent, I mean like 3 to 5 times a week.
A week?
At least 3 times a week.
Back to back?
Yes, not like back to back, but at least 3 times a week.
Don't mind me.
Which is not very easy in our environment because of work and all of that, people's schedules and all that. So if you've done that for at least 6 months at that age, then you can both go to see your doctor. But if you're below 35, below 40 as a male, you wait for at least a year, because there's so many factors that can affect conception. Yes, so don't, I'm not saying you shouldn't be in a hurry.
Okay.
Because everybody says there's no time. I, for instance, I started fretting by the time I was.
I went to discuss it. You know, our parents say your time is ticking.
Exactly.
Is this the time conversation?
There's family pressure, there's societal
it,
pressure, and all of that. So all of that would get to you. Even you yourself, you want to be like, I hope there's not something wrong with me. You know, when I got married, 6 months into my marriage, nothing happened, and I was like, hey God. I was like, what's going on?
Oh, wow.
No, I now told myself, I said, babe, you need to go and do all. No, worry what? No, doctors were the worst patients. I knew I had to wait for a year, but I wasn't patient enough. I wasn't 35 years.
I'm going to check.
You know, but I said I need to check and just be sure there's nothing wrong with me. So I did all the possible tests, every single test, I had them done, and it all came out clear. And I was like, okay, fine, so I'm fine. So what next? I'm
going to relax.
I waited for like 2 months. I told my husband, babe, man, you need to go and do your own. Like, just do yours so that we're sure we're cool. Yes, and then he did his and we were fine. Yes, and then it was at that point I told myself, okay, it's probably timing. We're probably not doing it at the right time. I'm probably not catching my ovulation days. You know, so I relaxed a little bit, knowing that there was nothing wrong with either of us. Okay, and then we now started trying intentionally, which is also not fun.
Which is the back-to-back.
Not back-to-back. You can't do back-to-back. Can you do back-to-back? I can't do back-to-back.
I didn't say anything.
I can't do back-to-back. When I say intentional, I started timing it and making it rhyme with my ovulation days. I had to get ovulation strips and all of that, and it was a hassle. Yes, but I was doing all of that. And then as God will have it, it came. It came. It came just like a few weeks to my first year anniversary. So yes, I got pregnant. So it was, but it doesn't happen like that. People, for everybody. Yes, for everybody. Yes. So by the time if you know you are already advanced and you suspect there's something wrong, advanced in age, I mean.
I went to say, like, sis said advanced.
No, advanced in age.
I understand.
In age. If you're above 35 or you're 35,
just check.
Please just wait for 6 months and then go to your doctor. You don't need to wait for a year because your clock is ticking. Especially for females, we don't have so much time. Before you know anything, menopause is knocking on your door. So the earlier you get checked and you find out what's wrong, if it's something that can be managed, let it be managed immediately. If you need to go for other options like IVF, adoption, then you know what to do on time. So you're not waiting, because I see a lot of women come into the clinic for ultrasounds at 45 and they just had like an IVF. They were lucky, it took in, and then they had maybe triplets or twins. And then into the first 3 months of conception, they lose the babies. Why? Because age is not on your side. So even if the IVF sometimes clicks or works out, the babies don't tend to stay when you're advanced in age. Because of your age, your hormones and all of that. Because even as you're pregnant, certain hormones need to help sustain the pregnancy. Baby. Yes. And if that is low because of your age, it would affect you carrying that pregnancy to term. Yes, so the earlier the better, basically. You know,
I picked up on what you said about you getting checked, like 6 months in.
Yeah.
And then 2 months in, you said to your husband, go get checked.
Yeah.
And I wanted to ask about, when you have your patients coming, what's the ratio of women coming to check, just the way you did, and couples coming in to check?
The ratio is like 10 to 2. 10 being women alone, 2 being couples together.
Really?
Yes.
Why is that?
Most times, I feel in our environments, men are not willing to go get checked, one. Most men have an ego and they just feel there's nothing wrong with me, why should I go to the clinic? It has to be your fault. Because I feel they have the perception that the woman, you're the one getting pregnant now. Why are you not getting pregnant? Like, what's going on? It should be on you.
I know a lot of people feel like I'm always supporting women on this show.
Meanwhile, it takes
but I've never met a man that anybody, any couple has admitted that, oh, my husband has some issues. The women
No, they don't say it. They take it up.
Hey.
You know, even those that come, I meet a lot of couples, not couples, I meet a lot of trying moms that are trying to conceive, you know, and they come in frustrated most of the time. You know, even after they've done all their tests and they've checked out and they're fine. And I tell you, okay, and they come back complaining, doctor, it hasn't happened. What's going on? I'll ask you, okay, has your husband been checked? Has he done his semen analysis? Is he okay? They'll be like, that he's not, I don't think there's anything. They even defend the husband. I don't think there's anything wrong with him. It should be my problem. And I'm like, you've done all your tests. Everything has checked out. Why don't you advise him to do his? And then if it checks out, and then you know that it's probably timing that is the problem, and then you're trying and you're timing your intercourse and all of that, you know, but they don't want to accept it. Even in homes, when it comes to
Wow.
families and all of
Yeah.
that, when relations come around,
It's
people
always the woman.
It's always, even when they're passing comments that, maybe what, madam, what's going on now? Why are you not, the husband will not even come to the defense, even when they know
That
it's
it
probably
might
not
be-
her fault.
yeah.
Yes. So I think in our environment, men are not, I think it's an ego thing, basically.
How do you
I
then?
think it's an ego
Because
thing.
I have seen it happen, and this person is close to me, and it just popped out that the question was like, has he just like, it can't be him, it can't have, and I know that I've never met. I'm not saying that any man that is infertile like you should, but I've always had women that TTC, like it's always like, more of a woman's problem
Yes.
than, and which is why I said when we started the show that this is not just for women. From
Yes.
the angle that you're giving us, the medical angle, it should be a couple's thing, like
Yes.
both come in and
Yes.
they check their hormones or whatever could be done, like a full
Yes.
check. So
I've
how
seen
do
a few
you,
though,
yeah,
that come
how
in
do you
with,
then,
with their spouses.
I know you're not, your job is not to, do this part, which is the emotional part, or
Yeah.
trying to, how do you then get women to tell their husbands to come in?
Ah.
You are just giving me this, my sister.
I just give them advice. It's either you take it or you leave it.
Wow.
Okay, if I tell you your husband needs to
Has to
get
come
checked
in.
just to be sure there's nothing, and you go home and you don't come back, then it's all on you. I can't.
Wow.
You can only take a horse to water. You can't force the horse to drink. So I just do my bit, advise them on what they need to do, and then it's up to them, basically.
Okay, which is fine. I'm not a doctor, but I'm really praying for that woman that is out there that needs a husband to go in to get checked. I pray that he follows you, and I pray that everything will be fine, because I think
Yeah.
it's also emotionally, it's a good place to be when you know that both of you are fine.
Exactly.
And then you start
and then you know.
Doing it intentionally.
Yes, intentionally.
Like, yes.
Yes.
Okay, this is how you're going to do it. This is the time that
Yes.
you're ovulating. Now, I think that puts everybody in a very good place, because TTC is a very, very emotional place to be.
Yes.
Because you're waiting
Exactly.
till it happens. It's
Yes.
not like when I do it like this, next
No,
week
no,
it will
no.
not happen. You are waiting. So when you are waiting, it's good to just know that I'm waiting and I'm fine.
Fine. Yes. Exactly.
And to the men out there, millennial daddies, millennial uncles, all of you, please, for the sake of everybody's emotional well-being,
Yeah.
your wife, your family, even because I know a lot of women hush these things, even if your wife knows that it's you, it's not coming out of that little place.
Exactly.
It's between both of you.
So
Whoever-
you can now work things
you
out
can
and
work
decide
things
on what
out.
next to do.
Instead
of living in denial.
Living
basically.
it now,
Yes.
it's not an ego thing. It's just a safety. I don't know, maybe it's a safety measure or the medical thing to do, the medically right thing to do. And this is where we're going to take a short break, because I think I understand how any woman would feel, because I'm sure most of the time they want it as well. They
Yes.
want their partners to come in, but they just can't.
They just can't get them to.
So we're going to take a short break. We're going to come back and we're going to discuss the other side of this infertility. And I'm sure you are looking forward to that. So we'll be right back. Welcome back, and we're still here in the studio with the amazing and beautiful Dr. Ejiro. So I am going to touch on the, let me call it the emotional side of infertility, because I know that this side of it is very emotional, which is the surrogacy and the adoption. But before we go into that, I want to ask you about the assisted reproductive technology, which is the art. Like how, because I always hear about IVF. It's quite popular in this climate, and I know that there are more. I just wanted to know why IVF is quite popular in Nigeria.
Okay, I would attribute that to the success rate.
Okay.
Yes, I think success rate and then the cost of infertility usually fits into that procedure.
Okay.
Basically, IVFs are just taking the sperm of the man, taking the eggs of the woman outside the body in a petri dish, putting them together, helping them meet to fertilize. The sperm fertilizes the egg, and then we take it back and put into the woman's uterus. Okay. So that's basically, it's called in vitro fertilization. Okay. So it's in vitro, it's done outside the body and then put into the woman's body to carry. Okay. Okay, now there are other forms of assisted reproductive technology. You have the intracytoplasmic sperm injection. This one you're taking out one single sperm. Okay. This is usually for men who have very low sperm count. Okay. They can't produce as much as 1,000 sperms. Okay. You know, the sperm count is supposed to be really high, over 4 million, and they're producing like 1,000, and then the ones you're producing are not so healthy. So they try to pick the one that is as active as possible, and then inject with a small needle into the egg to help it fertilize. Okay, we also have the IUI.
Okay. Is this option for men with low sperm count?
It's for anybody, but usually for those with very low sperm count.
Okay.
Yes, they use that. Why? Because they can't. Usually, when you're doing an IVF, you have the whole sperm is collected, which has a lot of spermatozoa in them, and then there are a lot. So it's like a trial. They just put it together with the egg, and the most active swings to fertilize. In this case, now they don't have so many spermatozoa because the sperm count is really low. Okay, so now they just have to pick just one sperm that is the most active. So it's not a failed procedure, and then they inject it into the egg, and then it fertilizes it. Okay, we also have the IUI. This we're just using a very small tube to take the sperm and inject into the uterus. Basically, so
that's great, because I know that there's always a lot of discussion about IVF, and we don't get to talk about the other option, which you have educated us about, and I'm quite, I just learned one or two things as well. So I'm going to go into, which is why I said the emotional side, because I realized that we Africans, I don't know if it's generally an African thing or Nigerians, when you talk about surrogacy or I've watched movies as well that surrogacy have gone wrong, even in other climes. And the adoption, because I know other climes are more open when it comes to adoption. Do you actually have instances where you advise your patients on these options? Yes,
definitely. Definitely, but I will not talk about surrogacy. I usually don't advise people on surrogacy.
Why?
Why? Because of our environment, number one. It's not, I don't think we've embraced it yet. I don't see us embracing it in the next 10, 20 years.
Why?
Because of our mentality. And then, there's a whole lot that comes with surrogacy. Now, this person, maybe your friend or your sister decides to help you carry your baby. A surrogate, first off, is someone who helps you. You're using the surrogate egg. So I'm not able to produce eggs. I have probably issues with my ovaries. I'm not able to produce eggs. Now, somebody volunteers to help me produce eggs, so they can use my husband's sperm or a donor sperm to help fertilize that egg. Now, it comes with the fact that this surrogate is the one producing the eggs. There's a genetical link. You're genetically linked to that baby. So now take, for instance, I want to help my friend be a surrogate. I tell you, okay, fine, I'll do it for you. We probably don't go through all the legal documentation and all of that, which is very crucial. I don't go through that. I just say, in the name of, you're my friend, let's just do it, And then I carry this baby to term, and then I have this baby. You know what it means to have a baby.
I know.
The whole emotions that come with it. You think you've loved someone until you have a baby, then you understand what true love means. So if the surrogate now has this baby and decides, oh my God, I'm so attached to this baby.
I'm so beautiful. Yes. You're like, I want this baby.
The surrogate is now telling you, his baby is mine, it's my egg, blah, blah, and you're going through a whole lot. It happens even in developed countries. That's why these days there's a whole lot of legal documentation to that. And even despite that, there's certain places in the US, certain states in the US where even as a surrogate or someone who decides to go into surrogacy, now you've gone through it, you had your legal papers, they tell you that even after the baby is born, you actually have to, you don't have access until you filed for an adoption. So you, as the mom that paid this woman to carry a baby for you, you still have to go through the process of adopting that child as yours.
From the mom?
Yes, from the mom. That's from the surrogate
even
now.
Even after my husband's sperm?
Yes, even if it's her own eggs too. Without her eggs, your husband's sperm will do nothing. So it's a whole lot. Some other states, once the baby is born, legally you're giving the baby straight up to the mom. Yes, but some other states don't allow that. So it's a whole lot.
Which is why I said the emotional side.
Yes, it comes with a whole lot of emotion. So most people don't want to even go through that. Aside that, imagine telling your mom you're carrying a pregnancy for somebody.
My sister.
What would your mom say first?
Hey.
Even not your mom, the society. You go to work, you're pregnant, and then you went on mat leave, and you come, where's your baby? It's not... In our environment, it's not acceptable. Most people that I know have done it here actually travel out to do it. Yes, I actually know a patient that came. She had done like 4 or 5 IVFs. I'd been monitoring her because she'll come, you'll fail, back and forth, back and forth. And then the next time I saw her, she said she's done with IVF. I was like, oh, the last one worked out. And she was like, no, I think she had the 4th one. And she was like, no, that she eventually used the surrogate. I was like, really, where? She said in the US.
Okay.
I was like, well, how did that work out? She said, yes, that she has a baby now.
Oh,
that
fantastic.
in fact, she's even advising her sister to do the same thing and all of that. So it works for some
her.
people. But then you have to do it somewhere. And it's a whole lot of money. How many people you have to pay this surrogate one? Or if it's an organization or a facility that does that for people, renders that service, you're paying a huge sum of money. Aside that, you're paying something to the surrogate herself. You're going to take care of her throughout the duration. Yes, of the pregnancy. So it's a whole lot. You have to have a whole lot of money to be able to venture into that process. So I'd rather advise people to adopt.
Adopt.
Yes, it's also not easy. It's not easy taking a child who is not yours and saying you want to make this child your own. So it's very dicey, yes. It's a very emotional.
It's an emotional place
it's
to be.
a very emotional place to be, really.
Because when I see people that adopt, because I have seen, some of my mom's friends that, they've gotten to that age, they're already grown and they couldn't have kids. And they decided to adopt.
Yes.
I really have a lot of respect for them.
Yes, because it's not easy.
Yes, it's not easy. And I always feel like we as millennials are more open to that. So when I see my mom's friends, older people do that, I'm always like, oh, wow. And mom's like, why are you wowing? Why are you wowing? I'm like, mom, because you just had kids, you don't understand that, it takes a lot of emotions to be able to take
a child as yours.
And then just say that, I'm going to love you like mine and I'm going to do everything that I can for you. So, I just have to ask, do doctors actually advise people
we do, but it's left for you to take
actually
it. Yes,
take
it's left for the patient to take it. Basically, the decision still lies with the patient, and it's not easy. I don't blame people that don't eventually go through with it. Yes, so
it's a very emotional side.
Yes,
and this is me again reaching out to any mom out there, couples, to be parents. God is with you and God is your strength. If you ever decide to take up, be it surrogacy, if you have the money, because I really it takes a lot of money, a lot of emotions. I really still pray that God be with you, because we as women, we're very funny. There's a lot of attachment, there's a lot of ups and downs when it comes to pregnancies, and you just don't know when you get so attached. Because me, I had a long stretch of time before I had my emotional attachment to my daughter, and I think that happens to some moms. Because I didn't say I'm like, oh, I'm in love. I'm just like, this girl, you stressed me for 23 hours. I'm just like, Jesus, I'm happy. But because I know how I felt when my baby came out, I was just like, oh, So, I think it must have been like a month or 2 months. I looked at her and I'm like, damn, this is baby, this beautiful girl. So, some people is immediately just have a baby and they're like, oh, this is mine, I'm not letting you go. So I really do pray that you find that what works for you. And we're going to take a short break. I'm not emotional, but I'm just going to take a short break and we'll be right back. Welcome back to the Millennial Mom Show, and it's me, your host, Tolu, the Millennial Mom. I got a bit emotional before we went on the break, but we are back, and we're going to take it soft this time. So, Dr. Ejiro, we are going to talk about you being a doctorpreneur. Where did you meet doctors that have businesses? Because I feel like, doctors are so busy running around and they're just like a neck and whatnot. So, you have a business. What made you think about, oh, I'm a doctor, I still have time, let me, because I know you have kids, you have family.
I have 2 kids.
It's almost like every woman that I've met now have a job, a business, like one side gig or something. What's going on? I need my own side.
Everyone is looking for the extra cash. That's just the truth.
Always about the money,
yes.
money.
Aside the extra cash, I'm not one to. I've always been business oriented. Even before I went into medicine. Even before I decided to specialize. When I left school, I was always at every point in time. I'm always selling one thing. Either I'm selling earrings or I'm doing hampers. I always make sure I'm doing something on the side, just for that extra income. Just so that you can save. Can actually use money for other things without actually touching your salary. Yes, so I'm always all for that.
Okay.
So I decided to go into retail.
Okay.
Yes, retail of gadgets, phones, accessories, tabs, and all of that. Yes, I do that on the retail side.
Okay.
Basically, I have a handle on Instagram.
Okay.
Bulk sale.
You see,
Yes.
even if you're a doctor, a radiologist, you can still have a side gig, and you know
Yes.
that's fine. Which I know a lot of people think, oh, I don't have time. I feel like, you know, it's always about your time management, how you are able to manage your time and whatnot. You know, when we met, I was talking about us talking about breast cancer.
Okay.
And you were like, oh, no, let's talk about, you know, this and that. But because we talk about self-care a lot here, and I feel like we should still touch on the breast cancer thing.
Okay.
Very quickly. I know we hear this a lot, especially during breast cancer. How do I check? Because I know you're a radiologist. I'm sure you can just give me one tip or two. I can say, ladies, this is how to check your breast. How do I check?
Okay, so usually I would advise one not to check don't check while you're on your period first off.
Okay.
Always have that in mind.
I
Give
didn't know
yourself
that.
like 3 to 4 days. Why? Because during your menses, your
boobs
menstrual period, your boobs are all lumpy.
Okay.
You know, the glandular tissue and all of that are proliferated. So
Okay.
you could mistake your normal breast tissue for a lump.
For a lump.
Yeah, so we advise you to wait for at least 3 to 4 days after your period. Then you check. Usually you just stand. You can do it very casually. You don't have. It's not like a big deal.
Okay.
It's not like something you have to prepare for.
I know, but you'll be shocked. Some people don't know how
bother.
to. Yeah, they don't know how to
Okay, so
check
if you're in your bathroom about to have your bath, you have a mirror in front of you, or even in your room before you go into your bathroom and you have a mirror in front of you, just stand in front of the mirror first off, okay, and then put your hand on your waist.
Okay.
You need to first of all look, and then you feel.
Okay.
So now the looking aspect, you're putting your hand on your waist,
Okay.
you're turning to both sides.
Okay.
Okay, while you're doing that, while you put your hand on your waist, you're pulling back a bit.
Okay.
Yes, and so you're turning to the side, both sides.
Okay.
While you're turning to the side, you're looking at both breasts to see if there's any difference between either one.
Oh, so it's like I look at this and then if it's
You're
I just
comparing
see there's a
both.
move or
Yes,
there's an extra.
If there are dimples on one breast, you look at the other breast, it's not there, you know that there's something there. Okay, if you see something that looks like a lump, you could actually see some lumps that are big enough if you just by looking.
Oh,
yes.
I thought it was a feel thing.
It's a feel thing, okay, but you can actually see huge lumps without feeling. Yes. Okay, if you do this, you would see them because the skin will retract backwards and then whatever lump is there would show.
So it has to be hands akimbo and movement.
Yes. Okay, so you're doing this and then moving to both sides and watching both breasts, just looking. You need to first of all even understand what a normal breast looks like before you can be able to tell there's an abnormal.
Ladies, check your breast.
Yes,
look at
you
your
need
breast.
to.
When you know what your normal breast looks like, you know what your
What
abnormal
an
breast
abnormal
would look like.
Yeah. So after that, then you go to the touching part. Now for the touching part, you have to do that lying, or the feeling. You do that lying down. Okay, so when you're lying down, you're putting the hand behind your head.
Okay.
If you're going to check the right, you're putting your left hand behind your head.
Okay.
Okay, so first of all, before you even go to the breast, just check around your neck. All here, we're just checking for lymph nodes. That's like nodes, yes, swellings. So if you feel anything abnormal, go to your doctor. There's no big deal. Tell your doctor, even if you feel it's nothing significant, but it's something that you know shouldn't be there. You go to your doctor, say, doctor, I felt this, so that you just check and be sure it's nothing serious. Yes, because some people can have lymph nodes that can point to something in both breasts or either breast. Okay, so after you've done that, you put a hand behind, and then you use your 3 middle fingers. Yes, and then you go in a clockwise or anti-clockwise manner, and you just keep checking. Okay. Just keep checking. Make sure you palpate every single part. You can do it twice, and then end at your nipple.
Sis, do this
just
yourself.
To be sure.
You don't tell any partner to do this, so you know how this is going to end if they do it for you. Do your thing yourself. I'm just saying. I'm giving you a side gig. You know, babe, let me help me check my breast. Just like, I'm not checking anything for you. Check your boobs yourself. Okay, that's a good tip. You see, I asked because there are a lot of women watching this show, and I know we hear about breast cancer a lot, which I'm very emotional about. I just want women to be aware of their self.
And also, sorry to cut you too, also if you have maybe like a family history, someone in your family has had breast cancer before, a self-examination is not enough. Make out time to go for an ultrasound. That still brings you back to my department. Come for an ultrasound every 6 months. To check both breasts. If you're below 40, do an ultrasound. If you're above 40, you go for a mammo, a mammogram.
Mammogram.
Yes. Okay. To just check to be sure there's nothing. Why? Because the earlier you detect there's a problem, if it's detected at the early stage, they can easily be managed than when it has spread. Yeah. So checks are very essential. And if you do a breast self-examination on your own and you notice there's something there, just go straight to your doctor or go and get a scan done just to check and be sure of what it is. Okay. And they manage appropriately. Okay. Basically. Okay.
So I'm sorry for the digression from our main topic, but I just had to touch on that. How do we bring a radiologist in here and not talk about checking our breasts? So it just seemed like most appropriate. So thank you for that self-examination tip. I'm going to make sure I put this side up so that you can know how to. You can always check back on our Instagram handle to check how to check your boobs. So let me not burden you with this serious stuff. What do you do for fun? Because then you're talking about making money. You're talking about being a doctor, checking boobs, infertility. What do you do for fun? Like, what do you do for fun?
I do a whole lot for fun.
I like play. That.
No, when it comes to that, I don't play. I'm all for self-care. I don't play when it comes to that because I feel if you work hard, you need to play hard.
Play hard.
There needs to be a balance.
That's it.
Like, it's not easy, first of all, being a woman, talk of being a mom. It's not easy. And then you're working mom. Even if you're a stay-at-home mom, it's not easy. So I always make out time for myself. Okay. 3 times a week, I go for dance aerobics to work out, have fun at the same time. I don't know how to dance, but I'm learning.
You're learning. We'll get there.
I'm seriously learning. So I do that for fun, just to relax. Okay. And I make that my own me time. When I go home, I'm changing for my workout. My kids will be like, "Mommy, let me come with you." Most of the time, I tell them, "Leave me alone. Let me just go
this is my own me
breathe.
Time.
This is my me time." Okay. You know, I do that, and also I hang out a lot with my friends. Not like a lot, but I hang out
reasonably.
Yes, reasonably with my girlfriends. Like we do fun hangouts. Okay. Basically, just to relax. Okay. Talk about something other than work. Kids, something else entirely. Okay. Because I feel it's very refreshing.
Yeah, it is.
It makes me sane. That's just the truth. It keeps me sane. Also, my husband keeps me sane because he helps to balance. Yes, he helps to. If he sees I'm getting worked up, I'm on the edge and all of that, he'll call me, "Babe, won't you go and hang out with your friends? Like, okay. Won't you go out? Are you not going out today? Like, just go somewhere and chill." Okay. Yes, because if I go out, I noticed it. If I go out and I relax, I have fun, I come back refreshed. Yes. Okay. I come back brand new. I'm not lashing out easily at the kids, at my husband. Like, I'm more sane. Okay. Because my job is mentally tasking. I didn't know that before I went in. I actually thought radiology was so cool. Oh. You know, yes, when I was in med school then, I used to admire radiologists. In med school, you have to go for certain postings. Okay. So when I was posted to radiology department.
You loved it.
I loved it. The fact that was the only department that had AC, number one. You know, it was, yes, because of the machine, so the place has to be really chilled. Cold, yes. Okay. So I loved that. I loved the fact that you're just sitting down and looking at your screen, doing what you need to do, aside when you need to go for procedures. Okay. So to me, it was really fun. And then my dad too has a diagnostic center, so I picked that flair. Okay. Even before I went into, even before I was done with med school, I used to watch him. I just loved the fact that you could see people's insides and know what's wrong, see that there's something wrong. So it was really cool for me. Until I now actually went into the radiology and I thought it was...
Not child's play.
No, it's not child's play. Not at all. Because you have to know everything about every other specialty. Okay. Like you cannot even not know. Okay. So all the time your brain is working. Your brain is working. It's mentally tasking. So the fact that it's mentally tasking, I can't do that. Come home, deal with the kids,
and not have your
make out time for myself. Won't I go crazy?
I know. Okay, we're going to do something real quick. Like, we're going to do something real quick. So I'm going to ask you questions. I'm going to pick one. Introvert or extrovert?
Introvert.
Juice or wine?
Wine.
Owambe, beach day?
Beach day.
Netflix and chill, dinner date?
Netflix and chill.
Dress or denim?
Dress.
Money or love? Girl, don't answer. Okay. Thank you so much, Dr. Ejiro, for coming to the show. This was very educating for me, and I'm sure we learned a thing or two. We are here. I don't have anything else to add to this as for conclusion because this is not my specialty. But you know I love you. Please do also follow us on our social media handles popping up on your screen. And say we'll come your way next time. It's still me, Tolu, the Millennium Mom. Keep being a super Millennium Mom. And I love you.